Hi, this is Dr. Matheson Harris with Utah Eyelid and Facial Plastic Surgery in Salt Lake City, Utah. Today I want to go over what you can expect after eyelid surgery and how you can ensure that you will get the best outcome. At the end of your surgery, we'll put antibiotic ointment on any sutures you may have and then hopefully fit you with lid lift goggles. Putting on the goggles is simple. First, place fresh gauze on both sides where your incisions would be in contact with the compression foam. Next, leaning slightly forward, place the goggles directly over your eyes, just like with ski goggles. Then pull the strap over your head and be sure it is snug and you feel firm but not painful pressure. We'll help you set the tightness, or you can follow the instructions in the box to measure your head circumference and get them set up ahead of time. Keeping the goggles on as much as possible during the first 48 hours is crucial to minimizing bruising and swelling and speeding up your recovery. If for some reason you can't tolerate wearing the goggles, we recommend you use ice packs on and off every 20 minutes while you're awake. Bags of frozen peas or crushed up ice in a Ziploc bag work great. Use a clean, thin towel or thin gauze between your skin and the ice bag. Ointment will be used 3 to 4 times a day on your stitches. Just apply a small amount using a Q-tip to avoid touching the incisions with your fingers. Do not rub on or near the incisions for the first 2 weeks. It's okay to shower the day after surgery and even get the stitches wet. Just pat them dry afterward and apply a fresh layer of ointment. The amount of bruising or swelling you get after surgery varies a lot depending on your age, general health, skin type, and a whole host of other factors. Everyone is different, so don't be alarmed if you seem to have a lot more bruising or swelling than someone else you know who had already had surgery. Also, it's common for one eye to swell much more than the other. This will even out with time. You may also experience some eye irritation and even swelling on the surface of the eyeball. This can make you feel like something is in the eye for a short time. You can use artificial tears or tear ointment on the eye to help alleviate this irritation. When the eyes are irritated, they produce extra mucus and may look red. This is not an infection and doesn't require antibiotics. Infections in the incisions aren't common but can occur. If after a few days you see worsening redness, swelling, or pus discharge from the skin incision, call our office right away. In this case, an antibiotic will likely be necessary. You can dramatically lessen the risk of infection by not touching the incisions with your fingers. Pain after surgery varies a lot, but most people just have mild pain the day of surgery, which tapers off by the second day. Our average patient takes Tylenol on the day of surgery, but some require stronger medication in the early hours after their procedure. If the prescription pain medicine isn't controlling your pain, please call our office. It's important to limit your physical activity in the days right after surgery. The first 48 hours, you shouldn't plan to be doing anything other than resting with the goggles or ice in place. After 48 hours, you're okay to do light exercise like walking, but should avoid any activity that raises your heart rate or blood pressure for a week. You also should not bend down at the waist with your head below your belt line. This can cause new bleeding and set back your healing. You can restart any blood thinning medications 2 days after surgery. Some mild bleeding is normal in the first day or two after surgery. Putting direct, firm pressure over the bleeding area for 10 minutes will usually help it stop. In the event you experience serious bleeding that isn't stopping or is causing an enlarging bruise, call our office. If your eyesight is affected by pressure around the eye due to bleeding, you may need emergent treatment and should call us or go to the emergency room immediately. Fortunately, this is a rare occurrence and can usually be avoided by stopping blood thinners and not resuming normal physical activities too soon. We like to see you back within 1 to 2 weeks to ensure everything is healing well. We'll call you the day after surgery to make that appointment and check in. If you feel you need to be seen sooner, call our office to schedule an earlier appointment. Thank you for choosing Utah Eyelid and Facial Plastic Surgery. We look forward to helping you feel and look your best.